Question 201. The nurse is caring for a client who has had a gastroscopy. Which of the following symptoms may indicate that the client is developing a complication related to the procedure? Select all that apply. A. The client complains of a sore throat. B. The client has a temperature of 100. F. C. The client appears drowsy following the procedure. D. The client complains of epigastric pain. E. The client experiences hematemesis. Question 201. Answer: B. The client has a temperature of 100. F. D. The client complains of epigastric pain. E. The client experiences hematemesis. Question 201. Explanation: following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, complaints of epigastric pain, or the vomiting of blood, hematemesis, are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure. Question 202. A client is taking an antacid for treatment of a peptic ulcer. Which of the following statements best indicates that the client understands how to correctly take the antacid? A. I should take my antacid before I take my other medications. B. I need to decrease my intake of fluids so that I don't dilute the effects of my antacid. C. My antacid will be most effective if I take it whenever I experience stomach pains. D. It is best for me to take my antacid 1 to 3 hours after meals. Question 202. Answer: D. It is best for me to take my antacid 1 to 3 hours after meals. Question 202. Explanation: Antacids are most effective if taken 1 to 3 hours after meals and at bedtime. When an antacid is taken on an empty stomach, the duration of the drug's action is greatly decreased. Taking antacids 1 to 3 hours after a meal lengthens the duration of action, thus increasing the therapeutic action of the drug. Antacids should be administered about 2 hours after other medications to decrease the chance of drug interactions. It is not necessary to decrease fluid intake when taking antacids. Question 203. Which of the following symptoms is common with a hiatal hernia? A. Left arm pain. B. Lower back pain. C. Esophageal reflux. D. Abdominal cramping. Question 203. Answer: C. Esophageal reflux. Question 203. Explanation: Esophageal reflux is a common symptom of hiatal hernia. This seems to be associated with chronic exposure of the lower esophageal sphincter to the lower pressure of the thorax, making it less effective. Question 204. The nurse is providing discharge instructions to a client following gastrectomy. Which measure will the nurse instruct the client to follow to assist in preventing dumping syndrome? A. Eat high carbohydrate foods. B. Limit the fluids taken with meals. C. Ambulate following a meal. D. Sit in a high Fowler's position during meals. Question 204. Answer: B. Limit the fluids taken with meals. Question 204. Explanation: The nurse should instruct the client to decrease the amount of fluid taken at meals and to avoid high carbohydrate foods including fluids such as fruit nectars, to assume a low Fowler's position during meals, to lie down for 30 minutes after eating to delay gastric emptying, and to take antispasmodics as prescribed. Question 205. A client with a peptic ulcer reports epigastric pain that frequently awakens her at night, a feeling of fullness in the abdomen, and a feeling of anxiety about her health. Based on this information, which nursing diagnosis would be most appropriate? A. Imbalanced nutrition, less than body requirements related to anorexia. B. Disturbed sleep pattern related to epigastric pain. C. Ineffective coping related to exacerbation of duodenal ulcer. D. Activity intolerance related to abdominal pain. Question 205. Answer: B. Disturbed sleep pattern related to epigastric pain. Question 205. Explanation: Based on the data provided, the most appropriate nursing diagnosis would be disturbed sleep pattern. A client with a duodenal ulcer commonly awakens at night with pain. The client's feelings of anxiety do not necessarily indicate that she is coping ineffectively. Question 206. If a gastric acid perforates, which of the following actions should not be included in the immediate management of the client? A. Blood replacement. B. Antacid administration. C. Nasogastric tube suction. D. Fluid and electrolyte replacement. Question 206. Answer: B. Antacid administration. Question 206. Explanation: Antacids aren't helpful in perforation. The client should be treated with antibiotics as well as fluid, electrolyte, and blood replacement. And tube suction should also be performed to prevent further spillage of stomach contents into the peritoneal cavity. Question 207. The nurse is caring for a client with chronic gastritis. The nurse monitors the client, knowing that this client is at risk for which of the following vitamin deficiencies? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin E. Question 207. Answer: B. Vitamin B12. Question 207. Explanation: Chronic gastritis causes deterioration and atrophy of the lining of the stomach, leading to the loss of the functioning parietal cells. The source of the intrinsic factor is lost, which results in the inability to absorb vitamin B12. This leads to the development of pernicious anemia. Question 208. The hospitalized client with GERD is complaining of chest discomfort that feels like heartburn following a meal. After administering an ordered antacid, the nurse encourages the client to lie in which of the following positions? A. Supine with the head of the bed flat. B. On the stomach with the head flat. C. On the left side with the head of the bed elevated 30 degrees. D. On the right side with the head of the bed elevated 30 degrees. Question 208. Answer: C. On the left side with the head of the bed elevated 30 degrees. Question 208. Explanation: The discomfort of reflux is aggravated by positions that compress the abdomen and the stomach. These include lying flat on the back or on the stomach after a meal of lying on the right side. The left side lying position with the head of the bed elevated is most likely to give relief to the client. Question 209. A client with a peptic ulcer is scheduled for a vagotomy. The client asks the nurse about the purpose of this procedure. The nurse tells the client that the procedure: A. Decreases food absorption in the stomach. B. Heals the gastric mucosa. C. Halts stress reactions. D. Reduces the stimulus to acid secretions. Question 209. Answer: D. Reduces the stimulus to acid secretions. Question 209. Explanation: A vagotomy, or cutting the vagus nerve, is done to eliminate parasympathetic stimulation of gastric secretion. Question 210. The pain of a duodenal ulcer can be distinguished from that of a gastric ulcer by which of the following characteristics? A. Early satiety. B. Pain on eating. C. Dull upper epigastric pain. D. Pain on empty stomach. Question 210. Answer: D. Pain on empty stomach. Question 210. Explanation: Pain on empty stomach is relieved by taking foods or antacids. The other symptoms are those of a gastric ulcer.